Artificial Intelligence Dr. www.abcpharma.net/English. What tell you a normal sinus rhythm and wide QRS complex after a leadless pacemaker implantation? Claude AI. When considering a normal sinus rhythm, NSR, and wide QRS complex after a leadless pacemaker implantation, there are several important factors to consider. 1. Normal sinus rhythm, NSR. NSR after a leadless pacemaker implantation indicates that the patient's heart is initiating impulses from the sinoatrial SA node, the natural pacemaker of the heart. 1. The presence of NSR suggests that the patient's intrinsic conduction system is functioning properly, and the leadless pacemaker is not actively pacing the heart. 1. This is a favorable finding, as it demonstrates that the patient's heart can maintain a normal rhythm independently. 2. Wide QRS complex. A wide QRS complex after a leadless pacemaker implantation can have several implications. A. Pacemaker-induced. The leadless pacemaker is designed to stimulate the right ventricle directly. 2. When the pacemaker is actively pacing, it can cause a wide QRS complex on the ECG due to the abnormal activation sequence of the ventricles. 2. This is an expected finding when the pacemaker is functioning correctly and should not be a cause for concern unless accompanied by other signs or symptoms of pacemaker malfunction. 2. B. Pre-existing conduction abnormality. If the patient had a pre-existing conduction abnormality, such as a bundle branch block or intraventricular conduction delay, the wide QRS complex may be unrelated to the leadless pacemaker. 2. In this case, the wide QRS complex would have been present before the implantation and is not a result of the pacemaker's function. 2. C. Pacemaker malfunction. In rare cases, a wide QRS complex after a leadless pacemaker implantation could indicate a pacemaker malfunction, such as oversensing, undersensing, or ineffective capture. 2. If the wide QRS complex is new and not explained by pre-existing conduction abnormalities or expected pacemaker function, further evaluation may be necessary to rule out device malfunction. 3. Clinical context. The interpretation of NSR and a wide QRS complex after a leadless pacemaker implantation should be made in the context of the patient's overall clinical picture. 3. Factors such as the patient's symptoms, underlying heart condition, indication for pacemaker implantation, and other ECG findings should be considered when assessing the significance of these findings. In summary, the presence of NSR and a wide QRS complex after a leadless pacemaker implantation can be a normal finding, especially if the wide QRS complex is due to expected pacemaker function or pre-existing conduction abnormalities. However, if the wide QRS complex is new or accompanied by other signs or symptoms of pacemaker malfunction, further evaluation may be warranted. It is essential to interpret these findings in the context of the patient's overall clinical picture and to consult with a cardiologist or electrophysiologist for proper management.